All right, you guys, so we're going to jump into kind of a little mini unit right here. It is not just one disease or one condition. We're actually going to look at 3 different conditions all at once in this mini unit that I've titled Thoracic. So we're going to look at what's going on with the bones and what's going to happen with the pleural space and also the spinal column. So we're looking at 3 different lectures kind of sandwiched into one. So let's go. So the first one we're going to start out with is flail chest. And flail chest, this typically happens from a crush injury. It can happen from whether it's an industrial accident or a motor vehicle accident. Sometimes this could be from even an impact of some sort. I remember one time I was playing softball after college, and there was a well hit ball in the outfield, and I went to go reach for it, and whenever I reached for it, I hit the outfield wall, and I just felt my ribs smash into the upper portion of the fence. And looking back on it now, that could have been pretty dangerous. But what we have here with flail chest is you can see that there's some paradoxical breathing. You've got the chest sinking in when the patient breathes in, and that's not the way it's supposed to be. When you breathe, your chest is supposed to expand, and this is something that is completely different. So paradoxical breathing is kind of a telltale sign when it comes to flail chest. But what is flail chest? If we look right here, we've got 3 or more fractured ribs in 2 or more places. So each one of these ribs have 2 fractures. So the way that you remember it is 3 or more ribs, adjacent ribs, 3 or more adjacent ribs with 2 or more fractures. So what this does is it leads to that unstable chest wall or rib instability. And this is where we get that sinking effect from that patient taking a breath in. So right here, as that patient were to breathe in, they wouldn't expand this chest. It would actually sink in, which leads to more conditions and more damages. So that lung is not truly expanding the way it should. Now look at the edges on this, right? If we look at the edges, those are not clean breaks. Those are not clean fractures. Just a little rub of this fractured, fragmented rib could lead to a perforation or a puncture of the parietal pleura. If I impede or if I tear into the parietal pleura, I now have an open pleural space. I have a pleural space that's now open to the atmosphere, and now atmosphere can get into the pleural space, and we have a whole different condition. It is a restrictive disorder. So our volumes are going to be well decreased, but when it comes to our flows, the flows should remain normal. So you can imagine that this would lead to lung collapse or atelectasis, that pneumothorax that we just talked about, pulmonary contusions, which is a bruise on the lung tissue itself, and pneumonia. And that's typically from the inability to expand the way it's supposed to. It can happen with a blunt trauma from a motor vehicle accident or falls, blast injuries, compression injuries, or occupational or industrial accidents. But most of the time when we see flail chest, it's going to be from a crush injury. So just know that that is where we will see it more often. So when we look at flail chest, you can see it here. We have those 3 ribs that have 2 or more fractures. This is actually 4 ribs that have fractures. This 5th one here has a fracture there, but it looks to be intact. Maybe a fracture there, but you've got 5 adjacent ribs that have 2 or more fractures. So this would be a exact definition of a flail chest when we look at this chest x-ray. So what do we want to do for treating these patients? Well, we need to identify, is this a mild injury or is it a severe injury? Well, if it's mild, the most kind of invasive thing that we will do is give them some anesthesia, give them a sedative or give them some pain meds so that they have a desire to breathe. Because remember that pain reflex, if you've got pain where there is rib fractures, you're not going to want to breathe there. I broke my hand in high school, and the pain of that was just so immense that I didn't want to do anything with my hand anymore. So imagine that happening at each and every breath. It's going to lead to some shallow breathing or holding a breath, which is not very conducive for oxygenation and ventilation. The other thing we can do is some airway clearance. We want to just make sure that the patient is able to patient's able to mobilize any secretions that may come as a result of the injury here. Another thing that we're going to look at is non-invasive ventilation or some CPAP. If we can maintain this chest wall, if we can maintain the structure of that chest wall with PEEP or with CPAP, that will be very beneficial as well. Now, when we look at a severe flail chest, one of the things that we want to ask is, what can we do to provide stability to that chest wall? Well, I just kind of talked about it a little bit. With a mild flail chest, we can add PEEP, we can add CPAP, we can add positive pressure to help keep those lungs open, even with the disconnect between the parenchyma and the chest wall itself. So mechanical ventilation, non-invasive ventilation, some way that we can add positive pressure to the situation here. Other things that we want to do is we want to just make sure that the patient's getting plenty of oxygen and that we are doing some sort of lung expansion, whether that's with incentive spirometry or a PEP therapy of some sort. So we just want to make sure that we do everything that we can to keep these lungs inflated during this injury. And just because it's a severe injury, we're still going to be using anesthesia or analgesia with the severe injury as well. But I don't want to use so much that I knock out that patient's respiratory drive. So we've got a delicate balance that we are working with when it comes to pain medications and continuing their desire to breathe. That was quick and easy. We got pneumothorax now coming up. We just finished up with that flail chest. So when we look at pneumothorax,